Hello, and welcome to the Employee Benefits Open Enrollment presentation for NV Restoration and Construction. This presentation is provided to give you an overview of the benefits that are effective November 1st, 2019 and will remain in effect through October 31st, 2020. So this is officially your open enrollment, which is your annual opportunity to make changes to your benefit plan elections or to enroll yourself and your dependents in plans that were not previously available to you. One thing to note, though, is that mid-year changes are only allowed if there's a qualified change in family status, otherwise referred to as a qualifying event. That might mean that you get married or divorced, you might have the birth or adoption of a child, but it also applies to your spouse's coverage. They may lose or gain coverage as it relates to their employment and their open enrollment as well. Also, it applies to any plans that are provided through the government, whether that be the state with Access or healthcare.gov. If any of those options materially change for you throughout the course of the year, then that gives you what they call a qualifying event, and you have 30 days to make changes to coverage from the date of that event. You'll do that by getting with your HR department and letting them know that you want to make a change by adding somebody to the coverage, deleting somebody to the coverage, or maybe putting yourself or someone on coverage that you did not previously elect, or removing yourself from them. You can move in, out, add people, remove people, etc. But keep in mind, it has to only be when there's a qualifying event, and you have 30 days to make that change to coverage from the date of the actual event. Your eligibility is based on the fact that you're a full-time employee, meaning that you're regularly working at least 30 hours per week, and you've also met your benefits waiting period, which is a 90-day period from your date of hire. It also extends to your eligible dependents, meaning your married spouse and your dependent children up to age 26. The agenda for this quick presentation is to explain your medical benefit options, what they are, how they work together, also explain your ancillary coverage options, that's dental and vision, and then also explain what you need to do to enroll. First, going to start with just a benefits overview showing you the different insurance companies that will be providing the different coverage available to you. So your major medical insurance will be provided by EMI Health. That will give you access to the Blue Cross Blue Shield big PPO network of Arizona, including Mayo Clinic. In addition to that, you'll have TransConnect, which is the deductible gap insurance that we'll explain, and then also a 24/7 doctor and pharmacy access resource known as WellVia, which I'll walk you through that as well. And then last but not least, you'll have dental and vision coverage available, and that too is through EMI Health. Let's take a look now at your medical coverage, which is provided, like I said, by EMI Health, but it gives you access to the Blue Cross Blue Shield of Arizona network, which also includes Mayo Clinic, and that's all in network. Keep in mind, that's the largest network in the state of Arizona, so you really should have no issue staying in network, and I highly encourage you to do that, because when you look to the right column, you'll see that out of network costs you twice as much as it relates to your out-of-pocket exposure. And you want to avoid that, obviously, and you clearly can easily due to the fact that this is such an enormously large network throughout the state of Arizona with Blue Cross Blue Shield, including also Mayo Clinic. So the EMI Health PPO 7000 plan basically is just that. It's a $7,000 deductible plan for an individual, and that's capped at $14,000 for your family. What that means is that when the deductible is required, you have to pay the first $7,000 as an individual, and that's capped at $14,000 for your family. But note, no one person in your family would have to meet the full family deductible. It's what they call an embedded deductible, meaning as an individual, you only meet your individual deductible. Now, on the next slide, when I show you the gap and how that's connected to each person that you might insure yourself, your spouse, your children, your whole family, you'll see that nobody will be hanging out there in the breeze with some big deductible without the gap. So I'll show you that in the next slide. But basically, the deductible per the medical plan is a $7,000 individual, and again, that's capped at $14,000 for your family. Once you pay that deductible, the coinsurance kicks in, and that's at 100%, meaning there's nothing else they'll charge you after you pay for the deductible other than just co-pays, which would lead up to your out-of-pocket maximum that you see below there at $7,350 for an individual, and again, that's capped at $14,700 for your family. So let's talk about some of these copays. You have an office visit copay for a primary care physician, which is $50, and to see a specialist, it's $100. Once annually per year, you can go get your preventive or annual physical. That costs you nothing. It's covered at 100%. There's no copay. There's no deductible. Emergency room, urgent care. First, urgent care is a $100 copay. An emergency room is a $500 copay. Keep in mind, if you are admitted to the hospital, that emergency room copay is waived because now it all becomes part of your inpatient hospitalization bill, which is covered at 100% after the $7,000 deductible. Outpatient surgery or facility is also covered at 100% after the $7,000 deductible has been met. X-ray and lab are covered at an office visit or freestanding facility. If it's in the hospital, it's covered at 100% as part of your inpatient bill after the first $7,000 deductible is paid. Advanced radiology is covered also at office visit copay if it's done at the doctor's office. But if it is a freestanding or other scenario where you're in the hospital or outpatient, then it's covered at 100% after the deductible. Your prescription drugs are covered at $25 for generic, $50 for preferred, $100 for brand name, and 25% for specialty drugs. I will show you some alternatives where you can save significant money and not have to pay those copays at all in just a few minutes. But that's how it sets up for your EMI PPO 7000 major medical plan. Keep in mind it has catastrophic coverage, meaning the out-of-pocket maximum of $7,350 for an individual and $14,700 for a family. So really, when you're buying medical coverage, yes, you're buying access to the network, you're buying the copays to see the doctor, pharmacy, etc., but you're also predominantly buying that limit. There's no way, no matter what happens to you or your dependents, that the insurance company can say you have to pay more than $7,350 for an individual or the $14,700 for your family. So there's your medical coverage. And in just a moment, I'm going to show you a concept called gap coverage, and that works alongside this toward the deductible and out-of-pocket maximums, which will greatly reduce your exposure and make this a very rich benefit. So now let me go ahead and illustrate what I was just referring to, and that is the gap coverage, which is going to pay first toward your deductible, which is part of your medical coverage. So you have EMI Health, which gives you access to Blue Cross Blue Shield. You have copays for primary care specialists, pharmacy, ER, and urgent care. For everything else, though, you have that deductible that you have to pay first, right? $7,000, and after that, everything's covered at 100% other than those copays. But to help you with that deductible and that out-of-pocket expense, we've got the gap insurance. So when you buy the major medical plan with EMI Health, you're going to have the gap included. They're going to be bundled together, and they're going to work together against the explanation of benefits with the EMI Health and the Transamerica paying first toward the deductible, which is great for you. One thing to remember, though, is that copays always count toward the out-of-pocket maximum along with the deductible. So your deductible is $7,000. We have the gap to help with that. Everything else that's copay related will count toward that out-of-pocket maximum as well. But if you go inpatient and you have that deductible of $7,000, you would have to pay that. But the gap's going to come in and it's going to pay first for you, meaning it's going to pay the entire deductible if you go inpatient, leaving you with only $350 for the out-of-pocket maximum. And you might have already paid that in copays, but that's the maximum after the gap plan pays the first $7,000 if you go inpatient. If you're outpatient, it's going to pay the first $3,500 toward your $7,000 deductible, meaning you'd be on the hook for the last $3,500 of the deductible or the last $3,850 toward your out-of-pocket maximum. Keep in mind, the best part about the gap is that it pays first dollar coverage toward the deductible, meaning before you reach into your pocket, your wallet, your purse, whatever, to go and pay the healthcare provider, you're going to hand them the Transamerica Gap card alongside the EMI Health card, and they're going to verify both benefits right there at the point of service with the healthcare provider. Because they're going to verify it, they're also going to assign that benefit to them as the provider, and now they know they're being paid. So when they know they're being paid, they're no longer asking you for money. So the Gap card will work almost like you had a credit card or a debit card, except for it's not coming out of your account. It's insurance that's bundled alongside your major medical coverage so that you don't have to spend your money out of your account. Instead, you present the Gap card along with the EMI Health card for everything except for those things that require the copay, meaning doctor visits or pharmacy. If you do find yourself in ER or urgent care and it's related to an accidental injury, meaning you've hurt yourself somehow, then present your Gap card there because the Gap will pay the copay for ER or urgent care in the event of an injury but not illness. If it's illness and you're somehow going into ER as it relates to illness, if you're admitted to the hospital, remember that copay goes away. But if you're not admitted, then you just have to pay the $500 ER copay. But that's how it all fits together. The Gap will pay first for inpatient and outpatient. Remember that outpatient also includes advanced radiology, meaning MRIs, which are the most common reason people have to pay toward their deductible. So inpatient or outpatient, you've got coverage that's going to pay first dollar for you, so you're not reaching in and having to pay that to the medical provider when you present them with your EMI card. So that's how the gap and the medical work to reduce your cost toward the deductible and your out-of-pocket maximum. I just want to show you a way that you can significantly reduce your pharmacy cost. Your pharmacy copays are a little on the higher side because we did that to try to save you some premium costs. But we knew that in doing that, we could also save you some money by just helping you to be a smart patient and a smart consumer. So the first thing is talk to your doctor if they prescribe something and say, "Doc, could I possibly use a generic instead of the brand name drug?" And they may actually write down the name of a generic, or oftentimes they'll write down on the prescription sheet there, they'll write down something that says dispense as other, meaning that the pharmacist will say, would you like to use a generic? In either case, you can try the generic, and in doing so, you can save yourself money because all of these retailers here have a 30-day supply for $4 or a 90-day supply for $10. It should include Albertsons too, because they're now part of Safeway. So Albertsons, Bashas', Costco, Fry's, Safeway, Target, and Walmart all have $4 lists. They have their own lists. They're not always exactly the same between those retailers. But let's face it, we're all in one of those places once every couple of weeks, and it's certainly an easy place to get lower cost pharmacy for a 30-day supply for $4 or a 90-day supply for $10. And you don't have to use your EMI Health Blue Cross Blue Shield card. You just walk in, hand them your $4 along with the prescription, and you're good to go. Great way to save some money on pharmacy. Another way to save some time and money as it relates to actually getting in front of a doctor is a thing called Well-Via. Let me explain. Right now, if you go to see a primary care doctor, it's going to cost you $50 once we start the program in November, on November 1st with this coverage. So you go to see a primary care doctor, you pay a $50 copay. But there's germs, there's travel time to get there. It does create a claim, and their availability oftentimes is limited based on how busy they are and vacation schedules and their golf, handicap and things like that. Urgent care is also a $100 copay. There's germs, there's travel time, there's a claim, and their availability can be limited as well. And then there's emergency room, where it would cost you $500 on the copay to be in the emergency room. There's lots of germs there. Travel time, yes. Claims, you bet. And then availability is 24/7, 365. But we all know that you can sit in an emergency room for hours if you're not really in peril. So another alternative that is both cost effective and far more convenient would be Well-Via. So I would encourage you to maybe start there. You can call them, and there's no cost at all to talk to a doctor or to have a video chat via Skype or FaceTime. So it's brilliant. We're using the technology of the day to access a board certified doctor that can diagnose, prognose, and even prescribe medicine over the phone to assist you, remedy you with a lot of the common things that people typically go to the primary care, urgent care, or emergency room for, which all have a higher expense. So we want to move that down to a lower expense that costs you nothing for the coverage and costs you nothing to use it. The Well-Via is all baked into your EMI medical plan. So we encourage you to use that. And here's the thing. There's times that you will need to go see a doctor at primary care, or maybe go to urgent care, or even an emergency room. But there's a lot of times, maybe 70% of the time, that people go to those three options instead of if they just had access to talk to a doctor or have the doctor look down their throat with the FaceTime or Skype applications. So there's a lot of different ways that they can see, whether it be allergies, sinusitis, bronchitis, common cold, flu, it might be a UTI, it might be a bug bite, it might be a rash, a variety of things like that that you can actually see or talk to, or have the doctor see you or talk to you, could actually facilitate a diagnosis, prognosis, and maybe even a prescription if that helps remedy your situation at a much lower cost with great convenience as well. Simplistic way to use this as well in the Well-Via, just one more point to make on this, is that you just simply call your Well-Via or schedule an appointment online with the smartphone app. If you have never used it before, you haven't gone online and put your electronic medical records, that's EMR when you see that on the slide, you can simply just prove that you are who you are. Here's the last four of my social security, here's where I live, etc. And then you can tell them over the phone what your situation is in your medical history. Upon that, it's scheduled with the doctor, the call or the video chat. The doctor will then look at the notes from the triage person that you've talked to over the phone, and then they will call you, diagnose the situation, and if a prescription is required to help remedy your situation, that can be sent via e-scripts to your choice of pharmacy, whatever's close to work, home, or wherever you want it to go. Once they do that, the doctor will update the electronic medical records with their consultation notes, and then that'll be stored online in the member encrypted and HIPAA protected portal for the next time, just to make it a very simple process going forward as well. Let's talk about what we call ancillary coverage, which is your dental and your vision. First, let's talk about the dental, which is provided by EMI, and this is the Summit Plus Cigna network. So you have in-network benefits, you also have out-of-network benefits, but I caution you, anytime you go out of network to a dentist, meaning that dentist is not contractually obligated within a network, that means they can balance bill you for other, for additional costs against what the insurance company would pay, meaning you could have to go more out of pocket than you anticipated. So the balance bill, I always say, buyer beware. You can go see a doctor that's out of network, but keep in mind the insurance company will only pay up to that, the amounts listed here, out of network, and the doctor still can balance bill you. So we encourage you to stay in network. The Summit Plus Cigna network is a very large network, and this requires a $50 individual deductible for everything that's not preventive, meaning basic or major services, and that's capped at $150 for your family. So it's $50 per person, but it wouldn't be charged for more than 3 people. Your annual maximum is $1,000, meaning after the discounts are applied from the network, and after they apply the coverage, they won't do any more than $1,000 worth of benefit coverage per person of dental work per year. Your preventive services are covered at 100%, meaning there's no cost to you, no copay. You're going to go in and you get twice a year a cleaning and an exam. Once a year they'll do your x-ray on your bite wing x-rays and that sort of thing on your teeth. The basic services, that's typically sealants and fillings, those are covered at 80% by the insurance company. You pay 20% after the deductible of $50 that you pay per individual. Major services, that's root canals, bridges, dentures, etc. Those are covered at 50% by the insurance company, the other 50% by you. There is no adult or child ortho on this plan, and your reimbursement levels are covered at what they call the UCR of 80 percentile, meaning usual and customary reimbursement. So again, you have benefits in network and out of network, but to not be balance billed, work hard to be in network. Best way to do that is talk to the dentist and ask them if they are a contracted in-network provider with the Summit Plus Cigna network. And if they say yes, then you know they're in network. And that's how your dental plan works. Let's take a look now at your vision plan. This is also provided by EMI, but this is the VSP network. That's the largest national network for ophthalmologists and optometrists out there, as well as some of the retailers. In addition to your in-network benefit, though, with VSP, you also have out-of-network reimbursement limits. That's where you may want to go to Lens Crafters, Eye Masters, VisionWorks, etc., as they work their deals, Sears, Costco, all of those different places that have different vision deals. You can work those deals and actually just pay out of pocket, submit your receipt, and VSP will pay you back up to the reimbursement levels that are issued there on the right. For in-network, you'll pay a $10 copay once every 12 months to see what you need as far as your prescription goes for your lenses and frames. Then you'll pay a $10 copay for your materials. That will give you up to a $100 retail frame allowance for your frames every 24 months. If you want something fancier or more expensive and it exceeds the $100, you certainly can get an additional discount, which is up to 20%. The eyeglass lenses can be changed every 12 months per your exam and what you need, and those are covered in full after the copay for single, bifocal, and trifocal after that $10 copay. If you want tinting, progressives, things of that sort, there's additional charges or copays for that and discounts applied. Contact lenses you can have in lieu of glasses. That's a $10 copay, and that gives you up to a $100 allowance for those elective contact lenses. If you need them because it's medically necessary, then you pay a $10 copay, and they're covered at 100% after that. Also, if you want additional glasses, there's a 20% discount on those as well through the VSP network. So now we just need to make sure you know how to enroll. So we would first encourage you to review the material in the open enrollment packet and make decisions about your benefit plans with your significant others and such and your family. And basically what you're going to do is you're going to look at that packet. You've got some stuff from EMI, you have a cost worksheet and all of that. Remember though that open enrollment is the only time you have to make changes to enroll yourself unless there's what they call a qualified change in family status or that qualifying event that I spoke of earlier. Be sure to complete your open enrollment worksheet and then return that to Human Resources by Monday, October 14th, 2019. Ideally, we give you that timeline because we are trying to get all the forms back, get them enrolled and implemented and installed prior to November 1st so that you have your cards in hand and you can verify coverage as it becomes effective November 1st, 2019. If you are becoming eligible after that date, then your HR people will give you your actual date that you have to get your packet back once you become eligible. So last but not least, we want to make sure you know how to contact us as your broker. I'm Mark New, the client executive and also managing partner of Dorado Benefit Advisors for your company, and also Marcy Craig's an account manager, and then Patty Erickson's also available through EMI Health. Very helpful people. So here's the thing. If you find yourself in a situation where maybe you're at the doctor's office, they say, we don't see you in the system, or at the dentist, or whatever the case may be, or you're getting something in the mail that doesn't make sense. You're like, why am I being billed for this? I don't understand. I thought that wouldn't be a charge to me. Or did they, why did they took my Gap card, but now it looks like they're sending me a bill for radiology and I thought the Gap was going to pay it. And just some of those little simple things that on occasion may happen. We want to let you know that you're not in it by yourself. Give us a call. We're happy to help. We consider our honor, our privilege to be coming alongside for each of you as you maximize your benefits that were intended and provided by your employer. So with that, we wish you well and give us a call if you need our help. Thank you for your time.